Hi, so my chemical is called aldosterone. In an overall perspective, aldosterone helps regulate blood pressure by managing the sodium and potassium levels in the blood. And aldosterone is produced by the zona glomerulosa of the adrenal cortex in the adrenal gland on top of the kidney. The chemical properties of aldosterone are below. The chemical formula is carbon, 21 carbon and 28 hydrogen with 5 oxygen. And the molar mass is around 300 grams per mole. It is solid inside the human body. The melting point is about 166.5 degrees Celsius. Solubility is 51.2 milligram per liter at 37 degrees Celsius, room temperature. It is lipid soluble. The disease state when someone has too much aldosterone production in their body is called hyperaldosteronism, which means exceeding 400 picograms of aldosterone per milliliter is considered too much. And the excessive aldosterone can lead to increased sodium retention, potassium excretion, and water retention in the body. This can disrupt the normal electrolyte balance and blood pressure regulation, potentially leading to hypertension, another word for high blood pressure, the low potassium levels, another word for hypokalemia, and other related health issues. The treatment for hyper aldosteronism is done by taking medications such as spironolactone, which is the most effective drug for controlling the effects of hyperaldosteronism, though it may interfere with the progression of puberty. The natural way of reducing the symptoms of hyperaldosteronism is to just take less salt. And both this hyperaldosteronism and which I'm going to discuss later, the hypoaldosteronism are diagnosed by simple blood tests. So when it's too little, it's called hypoaldosteronism, which usually means that the level is below 100 picograms. This can lead to symptoms such as dehydration, low blood pressure, high potassium levels, and an imbalance in electrolytes. So these are the two drugs that can help with hypoaldosteronism. One is diuretics, medicines that help reduce fluid buildup in the body. These are the first-line therapy for patients with signs of volume overload on examination. And the other one is called sodium bicarbonate. This adjunctive agent usually corrects acidosis, and by increasing distal delivery of bicarbonate anion increases urinary potassium excretion. And that's it. So this is a works cited page. Thank you.